and go.
Hi, my name is Becky Brockman. I'm going to show you how to insert an IV. Before you do that, you need to make sure you have a doctor's order, check for allergies like iodine, chlorhexidine, and latex allergy. And then you want to make sure you gather your supplies. So I'll go enter the patient's room. Hi, Jason. Provide for privacy. Come in, wash my hands. Hi, my name is Becky. I'm going to be your student nurse. Could you verify your full name and date of birth? He says his name is Jason Ortiz. His date of birth is 1/1/76. I verify that with the MAR, and it looks good. So doctor has ordered for me to place an IV for you to get your antibiotics. He verifies that that's okay. He understands why. He is okay with that. He can verbalize to me. He understands. He has, he is able to move around and let me know if he needs anything. So are you comfortable or do you want to adjust? He says he's fine, so we'll get started. All right. So I'll wash my hands. I'm going to place this pad underneath your arm first. If I can just have you go ahead and lift up your arm. And he says, okay. Thank you. And then I'm going to also place the tourniquet under your arm. And this should be placed 15 to 20 centimeters above the insertion site. Okay, it should never be left on for more than 2 minutes. I'm going to wash my hands. And I'm going to assess the skin. I'm going to look for a place for the vein where the vein is straight. It is distal to the joints, and make sure that there is a vein that is palpable. So this looks like a good place for me to go. So that's where I'm going to go. Okay. Wash my hands. I'm going to get my things ready. This package obviously would not be open. Make sure that it is not expired. Same with your saline. You're going to want to make sure that it is not expired. And then I'm going to use alcohol. Open this up. I'm going to alcohol the white end here. 15 to 30 seconds or per your facility policy. I would allow that to air dry. And then I'm going to get the air out of this. Very good. Okay. And I'm going to make sure that the end is not on too tight. I don't want it off, but I also don't want it on extremely tight. I'm then going to flush this. Make sure there's no air in there. Looks good. I'm then going to set it here by the patient. I'm then going to wash my hands. And then I'm going to get my package ready, or my bandage ready here. I'm going to then put my initials, the date, the time, and the gauge that I'm using. And we'll use that in a little bit. I'm going to wash my hands. I'm going to apply the tourniquet. I'm going to apply it in a quick release. I'm going to check for a pulse here. You don't want to, you want to make sure that there is still blood flow and there is still a pulse. I'm going to wash my hands. I'm going to put on my gloves. And I'm going to clean the area, starting in the center in a circular motion going outwards. Okay. I would allow that to air dry, and I would do that 15 to 30 seconds. I would clean that or per facility policy. Allow that to air dry. Okay. And then I would hold the skin taut, bevel up, 15 to 30 degree angle, I'm going to insert, watch for the flash. When I see a flash, I'm going to then go parallel to the skin. I'm going to go 0.5 centimeters further, and then I'm, without contaminating, I'm going to grab and I'm going to insert the catheter the rest of the way, and I'm going to pull out the needle. I would then put the safety on. For this purpose, I am not going to. I would then release the tourniquet. I would then take the cap off of here, attach it, still holding it, making sure this is not locked. I am then going to flush the line, and there should be no should go in smoothly, should not hit any resilience. Okay, then I'm going to clamp this. I'm going to get myself a piece of tape here. I'm going to tape this secure, and then I'm going to grab this, making sure that I do not touch the inside. I'm going to cover this, but not cover the whole end part there, making sure that this is secure here. I'm going to take this off, and then I'm going to take the part that I had already written on. I'm going to put it over to the side because I want to still make sure I can assess the IV site. Okay, then I can go ahead and take this off, and then I can tape this. I'm going to take this up here. This would obviously already be in the sharps container. I would take off my gloves, wash my hands. I would then put on a new pair of gloves. And I'm going to clean up all of my supplies. Anything that I leave here, everything would go in the garbage. Take off my gloves, wash my hands. I would then lower the bed, provide for safety, ask him if he needs anything. He says he's fine. I then would, before leaving the room, I would wash my hands. After leaving, I would then document the date, the time, the gauge needle I used, how much saline I used to flush the IV, and a lifespan consideration would be if I had a pediatric patient, I would maybe give them a teddy bear, maybe have a parent in the room for comfort. If I had an elderly patient, maybe use a smaller gauge needle and not so adherent tape. And then I would wash my hands before leaving the room, and that's it. Thank you.